I'm going to go into a couple of items specifically within eClinicalWorks. So I'm going to start with a few what are called smart forms in eClinicalWorks. So on my schedule here, and I'm working in the E version. So remember, this is the Google Chrome-based version that eClinicalWorks is moving towards and building new features within. I'm going to go into my patient for today. And on this progress note, there is a smart form that is not usually imported into systems when they are initiated within eClinicalWorks, but this smart form is free. It can be downloaded into your eClinicalWorks EMR database. It's very simple. All you have to do is put in a project with ECW, and if you're our client, we can certainly help you with that. But up here, this SF icon on the piece of paper, if you click that, it drops you down into a series of what are called smart forms if you're unfamiliar with ECW. If you are familiar with ECW, you're probably used to filling out the tobacco control for sure. The newer one that's available now is called this Opioid 2018 edition, but it's an opioid risk tool. So this tool was built by a pain specialist, Dr. Webster, but it's a brief self-screening tool designed for adults in a primary care setting to assess their risk for opioid abuse, and specifically for adults who have previously been prescribed opioids for chronic pain. So looking at this tool, it's a short series of questions. It was designed to be answered in less than a minute. So just a short series of questions, yes or no questions. And at the bottom, it calculates your total score and then risk level for opioid use. So just going through these questions quickly, it's about family history of alcohol, history of illegal drugs, the prescription drugs, and then the patient's personal history of alcohol and illegal and prescription drugs. So as I said, you go through, answer these questions, and if you notice, obviously we would want you to fill it out to make it comprehensive and complete, but if you don't fill out a question, it will still allow you to save the smart form just as it does with tobacco use. So we would go through here, answer the questions, it would calculate our score at the bottom, and you can see if you answer yes to specific ones, it's worth specific values. After you fill it out, you can save it, and that opioid smart form becomes a part of the patient's social history. The answers would also carry through. So there's our opioid risk tool. The answers would carry through to the next progress note as well. So you wouldn't have to continually fill that out. If you wanted the opioid risk tool smart form to be a part of your preceding visits with the patients, all you would have to do is open up this opioid risk tool again. The answers would already appear there, and you would say save, and then it would become a part of that progress note that you were working on. Again, that risk tool is free and can be easily imported into your eClinicalWorks database if you so choose, and it can be used as part of your annual wellness visits, of course. The next smart form I'm going to display is the depression screening. Now, there are two depression screenings in here. Medicare is rather vague with what they require through a depression screening, but one of them is more comprehensive. So the PHQ-2, the 2 simply designates that it's 2 questions, whereas the PHQ-9 is 9 questions. So we recommend using the PHQ-9. Going through this, again, it's a short tool meant to be completed in really a short amount of time. And the patient answers how interested they are in doing things, if they're feeling down, if they have a poor appetite. And again, you simply fill it out. It calculates a score. Now, this one you do have to complete all of the questions in order for it to give you a total score at the bottom. You'll notice if I uncheck that, we do not get a total score. So you would need to click it, check it off, save it. And it gives you that interpretation. And then I clicked out of there a little bit quickly. Let me go back in. The interpretation and kind of a compass, a guide for what that interpretation means. And just quickly, most of you, if you work in eClinicalWorks or even in other EMRs, I'm sure you're familiar with some sort of tobacco screening. This is the tobacco smart form. If you're not currently using it, I would highly recommend. And again, with this one, you can fill out one or multiple questions. If they answer that they're a current smoker, it will tree out into more questions. However, you do not need to answer every single one. That's really a practice decision. So those are a few extremely useful smart forms within eClinicalWorks. If you are in another EMR and you don't have those specific smart forms available, I would recommend doing something if you are able to, or asking your kind of EMR specialist what they know about is available in your system, because those three are a significant portion to annual wellness visits, as well as really just regular visits with non-Medicare patients too. Those tools may seem like a lot to fill out. Later in this presentation, I'm going to go through a way that we can kind of put some of the responsibilities into the patient's hand, and they can fill out those forms prior to coming in for their appointment, and relieve some of the time it takes for you as a provider or as another certified medical professional to fill out those questionnaires with the patient. I'm going to go into interoperability. Interoperability is, within the last year or two, a new feature within ECW that allows the system to communicate with other EMRs and import and export documents for your specific patients. And interoperability was really designed. One of the issues, the biggest issue we've really tried to tackle and help our clients with, is physician burnout. We know how difficult it is, especially to see patients with a long list of medical issues. Maybe they've seen multiple other providers, and you're trying to rally all of that information into your database now. So interoperability was designed to help alleviate some of the pressure and time it takes to get all of that information. Now, if you're in eClinicalWorks, so you go to the product activation screen to activate interoperability here. And there are two different interoperability systems, so Care Quality and Commonwealth. And we have PowerPoints available if you would like to learn more about this, but Care Quality and Commonwealth really encompass all of the major EMRs that are out there. So Cerner, Epic, Citrix, I think, is one, but there is a long list of different EMRs that are a part of this system. And if the practices that your patients go to are on one of those systems and they are signed with interoperability as well, you can communicate with those practices and gain those documents and some discrete data and import it easily into your system. So here is the settings. It's really easy to set up. It's a little bit misleading. All you have to do is connect with one of these practices that are in the Care Quality Framework or the Commonwealth Health Alliance Framework. And once you connect with one, you're connected with all of them. It gets a little bit confusing because over here it says connected organizations. I only have 2 listed, but I'm connected with everybody. It's just a little bit misleading. So how it works is it's an on-demand clinical data exchange. So there are some administrative steps you have to take. The patients have to be opted in to interoperability, which means they have to consent to it. So it has to be built into your practice paperwork. So there would be a little bit of front desk training for interoperability. But once the patient is opted in, they've signed that paperwork, and you're connected with the other organizations, the exchange of data happens as soon as you mark the patient as arrived. So once you mark this patient as arrived, the system runs a check almost exactly how it runs your check for insurance eligibility. So with insurance eligibility, the EMR connects with the clearinghouse connects with the insurances, gains that information, sends it back to the clearinghouse and into your system, and that's how you check their eligibility. With interoperability, it operates the exact same way. So there's sort of, it's not a clearinghouse, of course, but you connect to Commonwealth or to Care Quality. They act as your sort of quote unquote clearinghouse, and they then connect to all of the other systems that your patient may have been, or all of the other practices that your patients might have been seen at, and those practices send back the discrete data and the documents into your system. So as soon as they're marked arrived, interoperability will run that check. And I'm in a test database, so it's not going to pull in any information, but I can show you where to go and what it will bring in. And what I mean by discrete data, sometimes the terminology gets a little confusing as well. Also, while this is loading, oh, that's why. So there are two models for interoperability. One is called opt-in and one is called opt-out. If you've read up on the explanations that ECW has, the definitions for the two models, they're a little confusing. So I like to think of it as, if it's the opt-in model, patients have to opt in to be a part of it. So they're not opted in right away, they have to opt in to be a part of it. If you participate in the opt-out model, which is what we recommend, patients have to opt out to not be a part of interoperability. So over here on this EHX, this is your interoperability window. So if I had a working system and my patient had been seen at another practice, maybe they're on Epic, so it works through the care quality system, and that patient had documents and been seen by a provider on that Epic system, I would have information here to import to my progress note. What I mean by discrete data, those are specific items that can be imported directly into the corresponding sections in eClinicalWorks. The discrete data that's available to be imported right now is problem list items, allergies, medications, and immunizations. So those four can go straight into their corresponding sections of your note when you import them. And then of course you can import documents as well. So consult notes, any sort of labs, x-rays, procedural documents that have been done, you can import those as well, and they would go into the patient document section of your note. So interoperability is really designed to kind of alleviate some of that time it takes to gain the patient's medical records from other providers, and also improve the efficiency and accuracy in which you're able to see, assess, and treat your patients. All right, so moving back into the progress note, we're going to go through templates. Our training team here has created complete, full, comprehensive annual wellness visits, both initial and follow-up visit templates, and we can help you build those into your system. I don't have enough time to go through the complete template, but I'm going to show you, if you've never built templates before, kind of where to begin, how to build that data into your system, and then how to apply it to a patient. So over on the menu bar, if you click menu and then it's under file, you have templates here. And remember in E, if you don't know where something is, you can simply search for it in this box and open it up that way. So I'm going to start from scratch here. So I have this template list, and you have some templates built in from ECW. Maybe you built some in yourself, so you're familiar with building them. But I'm going to start from scratch. I'm going to click Add New Template. And we're going to call it, I always name it with an asterisk because it comes up at the top of your templates list and is much easier to find. So I'm just going to put my initials, your wellness visit, and then the date. And of course, you can name it annual wellness visit, initial female, initial male, follow-up female, follow-up male, or if you wanted to get comprehensive and make your templates for specific assessment codes, you could do that as well. The description, I'm just going to put annual wellness visit again, The facility, I leave it as all. If you're working in a multi-facility practice, I leave it as all so that all of your facilities can use it. Visit type. So this visit type is a little bit odd. Really, it just is an indicator for which sections of the progress note are available. If you're in a regular visit, you don't have the histories available. So I always make it the annual visit so that I can see all of the different sections of the progress note. And then I add it as a favorite so that it's on my right chart panel. Click OK, and it will open us up to a blank template. Now, the way that you can tell you're working in templates is at the top, it will always say T template, 39 years old, and male. It usually says as well. Unknown. The first thing I do is go into Chief Complaints because the name that you give the template always appears as your Chief Complaint, which obviously that doesn't make sense medically, so we just delete that. And we'll leave it blank for now. So a template works the same exact way as it does when you're working in a patient. So when you make a change in a patient's progress note, that change is saved live. There's no save button within the progress note. You just add your assessments, add your treatments, add your HPI and exam, and it all saves automatically. That's the exact same way that a template works. So when you're working in here, don't get confused that there's no save button. As soon as you make a change, that's the change on the template. So those first three that I went through, that your different smart forms, I want to show you a way that you can put them on the template without making them patient specific, but will give you that reminder that you need to fill this out as part of the annual wellness visit. So for my smart forms, I'm going to go to this opioid risk tool. And right now it's not filled out at all. Now to get something to appear, so we just click save here. So to get something to show for that, what you have to do is just fill out a no for one of them. And there are multiple ways to get into that smart form. So you can either go to it from the smart form icon at the top, or if you're in the social history section, that option will be available here as well. So if I put a value there, then it will appear on my progress. Now, note, of course, that may not apply to every patient, but the value and the opioid risk tool would be there. So then whenever somebody goes to fill this out for a real patient, all they would have to do is click this no. And what it does is it opens up this click-through screen. So whoever is filling out that opioid risk tool can go through, quickly click, maybe this is a yes, maybe this is a yes, no, no, fill out all the different answers, get that total score, and then it would display and change on the progress note. So really when you build templates, you're building in placeholders that can be filled out for your specific patients. Same with tobacco use. So you could fill out never smoker and leave it at that. Now with this one, it's actually a little bit better in my opinion. Well, it can go either way. So if I uncheck never smoker, it leaves the tobacco use header under my social history section. Now you can't do that with the opioid risk tool, but it leaves the header here, and then somebody would obviously have to remember to go in and fill out that smart form through the social history section. Now again, this is the same as if you went up here to the top under smart forms and filled it out from there. The formatting is just a little bit different. And that last smart form that I went through earlier is the depression screening smart form. So here under HPI, is where the depression screening, I say where it lives, quote unquote, where the documentation is built. And again, you can fill out 1 to get something to display in your template, and then whoever goes into the template with the patient can fill out the rest. And again, with this one, similar to the tobacco form, you can leave just a header there by then going out and taking out that never or that 0 value that you gave. But the headline depression screening would still be there, so whoever's filling it out could click into depression screening, go into the PHQ-9. Now, the only bad part of doing it that way is when I had one of these values filled out, just the first one, so it just says not at all, so somebody would know that that wasn't complete for the patient. But when you fill out 1, you can get to that click-through screen or straight to the smart form where it opens you up right there. So it's 1 click instead of 2. Now, the other items that are a part of your annual wellness visit, there are quite a few, but they can all be built into your note if they're not already. And then by building them into your system, you can add them to your template. So we have a lot built under this HPI section. And we had to build them into our system as well. So under this BP, that's a coworker's initials, Medicare annual wellness visit is where we built a lot of our different annual wellness visit items. Again, when you're building a template, you want to build in a placeholder so that you remember to go back in and fill it out for the patient. So I'm just going to do a few here. One of them is this fall risk and home safety section. And when you're going through here, you would want to put defaults. So we've indicated defaults within our system to be kind of the negative or the negative of that question. So for fall risk, negative, no falls. They can get up and go in under 20 seconds. The medication evaluation reconciliation was performed. The vision screening was performed, yes. And you can save it into your template as those defaults. Now I'm going to do a few more. Now, all of these items, you might be looking through your system and say, I don't have a Medicare annual wellness visit title over here. I don't have any sort of these sections or these symptoms that we've built into our system. So I can quickly take you through one. So if you would like to build a Medicare annual wellness visit category over here, what you always want to do is start with HPI, because you don't want it to be a parent-child sort of folder. So if I clicked BP Medicare annual wellness visit and then did a new category, it would go under this BP Medicare annual wellness visit. If I wanted it to be its own category, you need to click HPI first and then do a new category from here. So I'm going to name this my initials, annual wellness visit. Okay. Now I hide my categories, so give me 1 second. This is another feature in ECW, but you can hide these categories over on the left. So to get that one to display, so that you trust me that I built it. So MA, annual wellness visit, I have to check that off. And I might need to sign out and sign in, but we'll try it here. You guys are probably familiar with signing out, signing in multiple times a day. Me too. Oh boy, it's getting late. Okay, sorry, just check the time. So getting back into that template, again, menu, templates, and I want to go back into mine. Oh, we're working in this one. Okay. HPI, there's my MAAWV. So after you create it, make sure it's not a hidden category, and then you might have to sign out and sign in. After you've created your category, here under custom is where you would build your specific items. Now, we've added ours as structured items because then you have drop downs where you can build in answers. If you don't build them as structured, you can build keywords, but it's just a little bit more difficult to fill out, especially in a template setting and with your annual wellness visit. Since there is so much information you have to incorporate, you'll want those to be structured. Going back into this BP, so if you want to add something, really, again, you're going to add the negative or the kind of the standard, the default value to your template. And then when you're going through it with each patient, you'll be able to click through and quickly add those different items. So another one is cognitive screening. So we're going to add that in, and let me do one more. Let's do hearing screening, and we'll add in the default. So not done, concerned. All right, so that's what our template is. And again, when you're working in templates, it says T templates up at the top. And you can see the few different items we've built into our annual wellness visit today. Now, to incorporate that template into a patient, it's very simple. As long as you've added it as a favorite, when you go into your patient's note for today, over on the right side of your chart, there's a category called templates. Now, if you don't see this option, it's because your My Settings need to be changed. Templates, and to import it so you can view it as well. So if a provider says, oh, I can't remember what that looks like, let me look at it before I import it, you can click the little eyeball, and then they say, yes, I would like that. And she can import it into the note. So again, there are my sections. We did the hearing screening, not done, the fall risk. So once somebody goes in to fill these out, as long as you've added it as a template here, this is why templates are important. You can quickly change and say yes, and then uncheck that one, go to your next item, which is fall risk and home safety, say actually they're positive, they've had a fall, and make a note, the 2 falls. You don't ever have to go into that section because you can click through them very quickly here. Continually work through, so cognitive screening, actually, no self-awareness. Once you're done with that section, you can click OK, and it's been updated for your patient for today. That was a brief window into templates. Again, we've built comprehensive, and I can show you templates that have all of the information you need for an initial female visit, initial male visit, subsequent female, subsequent male. And it's very, very, very comprehensive and easy to fill out. Now, when you look at this, we've put all of our defaults into this to show anybody who's interested, which you obviously wouldn't have. This, how old are you? You would only see the underscore there if you built it into a template. We've just added all of the options to show somebody how it would look. you would obviously select one of the ages, their ethnicity or ethnicities, how do you best describe your marital status, but this is our complete annual wellness visit for a female initial template. Now, I want to show you one more item. They're called questionnaires. Now, this is the item that I spoke about earlier that would shift some of the responsibility of answering some of these questions to the patient's hands, which I'm a big believer that people should be responsible for their medical well-being, and this would give them the option to take a little bit more control of that through questionnaires. Now, questionnaires are, I can't say the only, but I think one of the only items that you have to build in EXE. So under this EMR questionnaire designer, so I've created this one for today called annual visit. It was initially only going to be review systems, which is why the ROS is there, but I've since shifted it. So what I've added is, the opioid risk screening, the smoking screening, the depression screening. I've also added a patient care team where they can go and fill it out, the get up and go evaluation, a space where they can fill out their medications, and then the HPI, so the depression screening in this section. Again, questionnaire training is something I can offer to you one-on-one. If you want to learn more about it, we can set up some time for right now. So this is it's really easy to build questionnaires. So all you have to do is name it. These are the items that you can build. So review of systems, social history, all the way through OB history. Now, these are pulling the items directly from your progress note. So if it's built somewhere in your progress notes in one of these categories, you can add it to a questionnaire. And the questionnaires can be filled out either through the patient portal or through the kiosk. And I know maybe some of you are thinking, well, my Medicare patients are older, they don't do this. ECW actually had some striking statistics at their last users conference, but the older generations are texting, they're using computers, so you might be surprised as to how many may be willing to go and fill this out and sort of help your practice out, taking more care of the autonomy of their own medical well-being. So I've filled out this questionnaire. I want to show you, I know we're getting short on time, so I'm just going to save it real quick and go into how it looks when the patient fills it out. So this patient portal login page, I have some test patients built in here. And the other cool thing you can do with questionnaires is you can link it to a specific appointment. When you log in here, so another category that would show here is your current appointment. And that current appointment would be linked to the specific questionnaire where the patient could go fill it out. The other option you have is to just upload it to the portal as a general questionnaire, which is what these are that I've already uploaded. So when you fill that out, or when the patient fills that out on the portal, when you go into their progress note for the day, this helo icon, now it's a little bit hidden in the E version because of the spacing issues, but you just scroll down up here. In the EXE, all 5 of these boxes appear straight across, but this helo box is how you import it. This little download button appears in red when there is something to import. And you can see this is the questionnaire that I just filled out on the patient's portal. So whoever's importing this, it could be the provider, it could be another staff member, certified medical professional, but they can look at these answers. They can say, okay, I just want to review it. So when you review it, it becomes a part of the patient's document section. But if you want it to become a part of the current progress note, what you want to do is import current page. So all submitted intake forms have been reviewed. And when you do that, and then refresh your page, the patient's answers become a part of that progress note for today. So it's gotten a little bit busy here. But I filled out the tobacco use online. And you can see there's also an option in ECW, which is what I would highly recommend. But if the patient is filling it out on the portal, you put a designation there to notify the provider, the staff, that the patient filled this out. And we've used *portal. And that's how you know the patient answered this question. It's a great indicator to know that the patient filled this out. This wasn't filled out by staff members. So if you do set up questionnaires, highly recommend putting that appended data on there, which is found under practice default.